Monroe Mayor Staci Mitchell says she is optimistic about the future of Glenwood Regional Medical Center. Good evening to you. I'm Jennifer Andrews. Well, it has a new operator and locals now have more control. Jessica Torricelli reports.
Steward, came in, bought the hospital, and then sold off the property. And then, of course, there's an overvalued lease agreement that the operating company has to pay back to the property owner.
House Bill 317 would have held property owners accountable if hospital managers let their facility fall into financial distress. After a state Senate Health and Welfare Committee hearing, that bill failed. It was sparked by issues at Glenwood Regional Medical Center under Steward Healthcare's management after they sold off the property to Medical Properties Trust and continued to manage the facility.
That model was created or done, so thinking that capital investment, the money that was received from the sale of the property would be put back into capital, into investment, into the facilities. But in this case it was not. It was pocketed, paid out to investors and dividends, and really came in and just stripped our hospital.
But now Glenwood is moving on. Steward is out, and there's a new operator in charge of daily functions.
They're letting the locals really run the hospital, which is a good thing. I do still think that the property needs to be owned by locals, but they are letting the locals, pretty much run the hospital. So the things are being done that's in the best interest of not only most importantly, the patients, in our region, in our community that use the hospital, but also the employees that work there.
West Monroe Mayor Staci Mitchell says the result is a fully staffed and supplied hospital. To keep situations like Steward's mismanagement from happening again, Mayor Mitchell is in favor of a different model.
I think hospitals should be owned by hospital service districts or not-for-profits, so that there are capital investment requirements, so we know that the best interest of the community, the patients, the regions are being looked after when they're locally owned or not-for-profit owned. I'm not a fan of the for-profit models. This has not been a great experience for our community.
And through all of it, Mayor Mitchell says the employees were always there.
And I want to give all the praise and commendation to the people that work at Glenwood, because they worked under some extremely challenging conditions, and they are the reason that Glenwood Hospital is doing good today.
In West Monroe, Jessica Torricelli, KNOE 8 News.